We pointed out then that a typical breakfast should 50% should be your staples, 25% would be fruits and vegetables, and the next 25 would be like meat or legumes. And what we saw clinically is that people who are on the sabbatical diet age very slow. The second problem we pointed out was excessive preservatives in our food, and we said that the human body is two creatures. We are a combination of human cells and bacterial cells, and the bacterial cells are outnumber the human cells 10 times. So food must also protect the bacteria, but obviously if you are eating food that has a high preservative quality, then you are going to interfere with the bacteria. White flour, we pointed out, is actually have preservative factors, and the preservation comes also through pesticides, antibiotics, and especially chlorine in the water. And all these products have antibacterial effect and interfere with our intestinal bacteria. And the way to correct the imbalance is to use prebiotics. Prebiotics is another word for anti-preservative. Well, we don't use the word anti-preservative in medicine, we say prebiotics. And we showed how prebiotics works. A simple example is that if you have a glass of milk on the table and you add lactic acid, lactic acid acts as a prebiotic, and you'll have yogurt the following morning. While if you didn't add the acid, you'll have spoiled milk. And obviously, you can see the difference between those two products. Science has shown many times that the gut bacteria is related to many diseases. A few of them are listed there. And what we pointed out that wine is the mother of all prebiotics. There's no compound on earth that has more prebiotics than wine. And wine that was used 2,000 a year in the time of Paul, and Paul talks about it, tells Timothy how to use the wine for his stomach and his frequent illnesses, was very much different from the wine we're using today, because they were not concerned so much about alcohol, and as a result, most of the sugar were converted into prebiotics. And we mentioned some of the prebiotics, like the lactic acid, the fructooligosaccharides, and the esters and polyesters, which is a combination of these acids with sugars, alcohols, and amino acids. And the Jamunogizer formulation, we use the prebiotics formulation in wine to develop the product. One of the areas we had a little problem with that, I said I will just go over it, and how does prebiotics help in the immune system. And what you see here is a diagram showing cancer in the brain, and this cancer is identified by this red object. Now, what you have in your blood is two types of white cell, essentially. You have what you call helper white cell and killer white cell. Now, what the helper white cell will do is take samples from the cancer and transport it down to the bowel, and primarily in the appendix, and deposit that extract in the appendix. Now, once it deposits the extract in the appendix, the normal thing is that the bacteria react to the extract and produce products that helps them to destroy this invader into their space. Now, the product they produce, we call it plasmid in medicine. And what happens, the appendix has a lot of white cells, killer white cells surrounding the appendix, and they can extract this factor and use that factor and multiply it, so they now know how to destroy the cancer. And this is how the prebiotics work. So the prebiotics is going to get the bacteria very healthy in your appendix and in your intestine. So when this information is transferred, it can be used in a useful way and so on. So obviously, if the appendix is not healthy, if the bacteria is not healthy, then the whole process would be affected. The third problem we pointed out is the destruction of drinking water. And water has been destroyed in many ways. This goes all the way back to 1852 when we started to chlorinate water. But even today, we are removing a lot of the particles in the water, and the excess sulfur in the air. Most of the sulfur in the air around us is from human activity. And all these factors, including the contamination of soil, result in the destruction of the particles that are normally present in the drinking water. Now, these particles are very important in removing the free radicals that forms in our body, and it does so by a process called dismutation. And we showed how that these particles can react with protein molecules. So obviously, if you react with the protein molecules in your blood vessels, the blood vessel cells are going to become very stiff, and therefore you get hypertension. You can react with nucleic acid in genes and reset the genes, and if you reset the genes, you're going to get cancers. The presence of free radicals affect your white blood cell functions. So even though your white cell may know how to kill the cancer, if free radicals are surrounding the cancer, the white cells cannot attack the cancer. And it also affects your stem cell, which are your repair cells. So obviously you have to be removing these free radicals if you want healing to occur. And what we pointed out, that the body has a process called dismutation, and this is the ability to move oxidants and free radicals from one form to another form. We said the usual form that is formed in the body is a superoxide, and this is a very toxic molecule, but the body is able, with the help of the particles, to convert it to the hydrogen peroxide, which makes it easier to transport. But the body can also change by the hydrogen peroxide to a hydroxyl radical, which is also very toxic, and use that radical appropriately to kill cancer cells and such. We showed a little diagram how the free radicals are moved throughout the body. Obviously, the muscles here is producing the free radicals. As the body use oxygen, 2% of your oxygen will always form free radical. This, if you have an infection, this can even increase up to 5%. So these particles will remove or mobilize the free radicals into your adipose tissue, that is your fat, or the spaces between the cells. And then there are particles here that will convert the free radicals by dismutation into hydrogen peroxide. And once you get it in the hydrogen peroxide, you can transport it to the blood, to the liver. The liver will recycle it. You can transport it to the kidney, where the kidney use it to kill viruses and also remove some of it. And most of it ends up in the intestine, to where it's converted in a form where the bacteria can use it in their metabolism. And we went a little how this mutation helps to destroy cancer cells. This was a little diagram we showed. Here's another situation where a cancer cell, again represented by this red dot, and we see here some X's around, and these are free radicals around the cancer. One of the things that cancer does, they know your body, your white cell cannot penetrate free radicals, so the cancer will create a free radical wall. So as here are these white cells here, these are killer white cells. They are all charged up. They know how to kill the cancer, but they can't access the cancer because the cancer has created this free radical wall. So if you have the particles that comes in from water, what they will be doing is removing these free radicals and transporting them to the adipose tissue, or to the fat. In the fat, they'll be converted into hydrogen peroxide. The hydrogen peroxide will travel with the sugar. Wherever sugar goes, the hydrogen peroxide will follow it. And as we know, cancer cells love sugar. They consume sugar 20 times more rapid than a normal cell. So obviously, if the cancer cell begins to take in the sugar, it will also take in the hydrogen peroxide. The hydrogen peroxide can be converted in cancer to hydroxyl free radicals and destroy the cancer cell. So removing the wall once will make the white cell able to go in and kill the cancer cell, and also the cancer cell will now have a problem, because as it feeds, it will be destroyed by the free radicals coming in. All right, so Jamunogizer, again, is supplemented with minerals similar to those that are present in natural water. So in fact, we are fearfully and wonderfully made, and the reason why we are having all these health challenges is because of how we have destroyed our food and water and the way we are consumed our food. So Wayne, at this time, you could go ahead with the questions that we have.
Okay, thank you, Dr. Robinson. Let me just bring up the chat window. Okay, the first question is, can the product help with high blood pressure?
Right, the product can help with high blood pressure. Unfortunately, Mr. Coleman wasn't able to show that video on with the gentleman who had high blood pressure for 30 years and how he had benefited from it. What has caused high blood pressure primarily is free radicals. The blood vessels are made of muscular-like cells, and these cells obviously are generating free radicals. So if you're not removing the free radicals are going to accumulate in these cells. And once they accumulate in the cells, they are going to damage the elasticity of the cell. So once the cell loses elasticity, the cell cannot expand and contract when the heart beats and relax. And as a result, the pressure goes up. And this is what we refer to as sometimes essential hypertension. Now, once you're taking the product, and you begin to dispose of the free radicals, as we show, converting them into hydrogen peroxide, dispose of them through the liver, kidney, and intestine, then the free radical levels will be removed from the from these blood cells. As a result, now the stem cells, which we said before, are unable to enter the cells, are unable to replace the cells if there's a high free radical level, will now begin to make new tissues for the blood vessel lining, and these new tissues will have the elasticity, and as a result, the pressure will be reduced over time. Now, depending on how long you have the pressure, you reverse, the time to reversal will vary. What we have found that most people within 3 to 4 years will be reversed. But if your pressure is just there for a year or two, within 3 to 6 months, you will see a reversal of your high blood pressure.
Okay, thank you, Dr. Robinson. All right, the question is, what is the preferred way of taking the immunogizer stem cell for best results?
All right, the immunogizer, as we said, is really targeting your food, and it's also targeting your water, because we mentioned the presence of the prebiotic to counteract the preservative in your food, and we mentioned also the dismutation factors that are missing from water. So you want to take the product just before eating. So as a result, the prebiotic will mix with your food in your stomach and therefore protect the bacteria from the preservative and therefore improve the growth and quality of your bacteria. On the other hand, so you want to do that at least twice a day with your 2 main meals, breakfast, which should be your most important meal, and your dinner. We also recommend a 3rd dose at night, which is best way to do that is just to put it in a glass of water. So you're trying to get more the effect of the water now. You're trying to recreate the water. It would be more like the natural situation, so the dismutation factors can go in and help with the removal of the free radicals.
Okay, thank you, doctor. There's a question, is should immunogizer product be taken with a special diet?
All right, we did mention the best diet is the sabbatical diet. All right, and this is a diet that is prescribed in Exodus chapter 16. It's a restoration diet, all right? And the key things in the diet, as we said, the main thing is that you should have 6 heavy breakfasts. Now, once you have those 6 heavy breakfasts, what you are doing is programming your body or co-programming your subconscious to start to build new tissues, all right? Then 1 day for the week, you're going to fast. Once you fast, it's going to, again, program your body in this time to remove old tissues. So what you'll have is a situation where 1 day you remove old tissues and the next 6 days you'll be putting in new tissues. So if that process is going on, obviously you are seeing restoration. In other words, you're getting rid of the old and replace it with new. The process of removing old tissues is much faster. To break down something is much faster than to rebuild it. So that is the reason why you only need 1 day to break down and 6 days to rebuild. And we recommend, as we said, that your plate, half of your plate should be staples, and that's very important, and very much like the manner that is described in Exodus 16. It was like coriander seeds, so it had a lot of starch. It also had some sweetness to it, because it was like wafers of honey, so you notice a glass of juice there with some sugar. Often we have thought that sugar is bad. Sugar is bad because we are eating in the wrong pattern. Once you start eating the wrong pattern, you get a different effect from the sugar molecules.
Okay, thank you, Dr. Robinson.
Before you go on, if I may, Doc, could you address it from this perspective? Let's say I'm on a diet from my doctor now. Would you recommend me still to take the immunogizer if I'm on a diet from my doctor, put me on a diet?
Okay. The thing about a lot of these diets that they are recommending, right? They may have an advantage in 1 or 2 areas, but in terms of the general body, it's not going to be satisfactory. What you are seeing here, if you eat in this pattern, what you're encouraging is restoration. In other words, you are changing out your parts. So let us say you have heart disease. I mean, I've had patients with heart disease. I mean, severe heart disease, what we call New York stage 4 heart disease, or now New York 1, New York 2. In other words, we were able to reverse the heart disease because the person each week is taking out part of the bad parts of the heart and is replacing it with new heart tissue and so on. So this is a diet that was designed, how we were designed to eat. So once you eat like this, you're going to reverse the old tissues, and therefore you're reversing disease. And if you want to get the full capacity, as I said earlier in the first webinar, that your lifespan is actually 120 years. It's not 70 to 80, and the scriptures also bear that out, and science also shows that. You have to be eating in this pattern, so you are getting new tissues being formed each week, and as a result, you can survive this kind of time in a healthy state. You know, not in a bedridden state, but in a healthy state. And where you see, especially what we have seen, is that work very effective, especially in our older patients. We have a number of patients in their 90s and 100. And one of the things I often do is ask people when I see them, how old do you think this person is? And they usually say 60. And these are the people who are 90s. And one particular patient actually went to the bank one day, and she's what's in her 90s, like 92, and they wanted to remove her from the elderly line and put her in the regular line. So she pointed out to them, said, no, she's older than all of them, and so on. And that's one of the, once you follow the diet, you're going to see in your aging is going to be slowed significantly.
Thank you very much, Doc.
Okay, thank you, Doc. All right, and how long will it take before we see any results from taking the Immunogizer stem cell product?
All right, the time depends on a number of factors. It depends on the condition. It depends on which disease you have. It depends on how severe the disease is, right? Let us use the example with Wendy. Wendy, when she came to me, she had stage 4 breast cancer that had metastasized to her spinal cord, not the spinal cord, but the bones in the spinal column. She got PET scan, and there was about 6 lesions there. Within 6 months after she repeated PET scan, there was no lesion. So she took about 6 months to reverse her situation. We have Dr. Joseph there we didn't show that video. She's in Grenada. She called me. I knew her when she was in medical school, and she called me and told me that she had stage 4 lung cancer that had spread to her brain. She had 2 lesions in the brain. She had gone to Florida and did some tests, and they told her that she had to go on palliative treatment. Within a month, she was back to work, and she was very short of breath and so on. She repeated her scans about a month or 2 ago, and there's minimal lesions there in her lung. Her lung actually had 20 lesions. One of the lesions was about 8 centimeters. We have had hypertensive who within a month, their pressure is back to normal. And again, the average hypertensive usually have a 10-year history. We see about 2 years before it is reversed. So it varies. It all depends on a number of factors. But you will start seeing changes, but you probably won't see the full effect until after a certain time. But usually within 2 to 3 years for the hypertensive. Cancer people will start seeing some effect within 2 to 3 days, but it's going to take about 6 months to reverse most of the cancer lesions.
Okay, thank you, Dr. Robinson. Yeah, there's a question here. What's the proper way for it to be taken? And you did say that a teaspoon should be taken before meals.
Right. And you could also take a teaspoon at night with water, so you get the water effect.
Yes. All right, there's another question here. Can you overdose on Immunogizer? Yeah, I think that's a question I don't want to ask.
The thing about what is using Immunogizer is food, right? Yeah. So just like so you can be a glutton and you eat too much food, I mean, you can take too much Immunogizer. I mean, but that would involve you taking probably 1 or 2 bottles a day before you start to reach in that realm to cause overdose. Yeah. So you normally take 2 to 3 teaspoons a day. So it's unlikely you're going to overdose unless you are really drinking, as I say, maybe a quart for the day. Then obviously you might get too much acids coming in from the product.
Yes. Okay. All right. Can it help with large masses to shrink it? So large, like one, being pregnant.
Yeah, a large mass. I think you have a cancer mass or a fibroid mass. Yeah, not certain. All right. Let me just say a little on cancer mass, because that is one of the areas that we are struggling with, because it's not a problem in removing the mass. And I had 2 patients recently, one who had a large mass in his abdomen, and we were able to remove the mass. But once you remove the mass becomes a large bag of pus. And it was real problem for me to get the surgeons to go in and remove the pus, because once the body kills the cancer cells and so on. So you don't want to wait till that point, because you're going to have some complication in removing the mass. If your patient presents like at stage 1, stage 2 cancer, stage 3, I mean, that's easier. The mass is usually much smaller, and it will remove much easier without these complications and so on. So the real problem with large masses is that you might have to get some drainage of the pus that is formed, because there's a large amount of cells that are going to die due to the whole dismutation and the white cell killing the cancer cells.
Okay, thank you, Dr. Robinson. Question is, why is the product so sweet?
Well, it has a lot of sugars. That's why it is sweet. As I pointed out, if you go into wine, a lot of the prebiotics are attached to sugars. They are attached to what they call sugar alcohols like glycerol, sorbitol. Those are also sweet products. Some of the prebiotics like the fructooligosaccharides, these are sugar products and so on. But the sweetness also, the level of sugar, what we call the brick level, is also important for from a preservative point of view. That's a natural preservative because it has a certain amount of concentration of sugars. It is not possible for bacteria to grow in it. That's like when you purchase your syrup, you can keep it outside the fridge because the brick level or the sugar level prevents bacteria from growing in it because obviously they will dehydrate the bacteria and so on. So the level of sugar is important for binding of the prebiotics, but also from a natural preservative approach.
Okay, thank you, Dr. Robinson.
Mm-hmm.
What is the best way to eat while taking the immunogizer?
Well, we're back to the sabbatical diet again, and as I said, you can download the sabbatical diet made simple book from the website. Mr. Coleman had pointed out how to get to that. Yeah. It's a nice little booklet, and it tells you how much food based on your height you should be consuming, and how to consume it, as we mentioned. He also pointed out that we have some little videos there that helps you and guide you in doing that. But this is the way we were designed to eat. We are design creatures. We are not creatures of accident. And just like in anything else that is designed, there's always a manual as how to operate that machine. So yeah. your physical body is like a machine, it's a biological machine. And this is how it is designed to operate. So as you operate it this way, as I said, your body will change parts every week. In fact, you are designed in such a way that you can change almost all your parts in every 10 years. So physically, you should be more than 10 years old, although chronologically you are much older, obviously. But physically, you can stay within a 10-year. 10-year body is far more resistant to disease and so on than one which is 40, 50 years.
Yes. Mm-hmm. Okay, this is not a question. This is actually a testimony.
Mm-hmm.
And it says, I must say I'm pleased with the results I got after using the stem cell.
Mm-hmm.
It healed my kidney issue.
Mm-hmm.
And I want to know if I should continue with the product, if it should be a part of my diet going forward.
Mm-hmm. Well, we're happy to know that it has reversed our kidney disease. I have a number of patients who have kidney failure. Some of them who were on dialysis that has come off dialysis. Some of them wanted to go on dialysis, as we saw there with Mr. James. She was recommended to go on dialysis. In fact, when I saw her, she only had 12% kidney function. Yeah. Once you go below 20% kidney function in Jamaica, we usually recommend dialysis. It's a little lower in the States. I think they go down to 15%. And we have reversed many of these patients, some back to 60%. 60% is considered normal, some in the 40s and so on. Now, remember, what we are saying is that the things that are in Immunogizer, if you are in a natural world, you will be getting them. If you are drinking natural water, you'll be getting them. And there's a reason why they are there. They are there to keep the body functioning and removing the free radicals and so on. Because you can't stop making free radicals. 2% of the oxygen that you take in today is going to make free radicals. If you can't remove it, it's going to store into your cell. Once your cell reaches its full capacity, it's going to start to leak out. And once it starts to leak, it is going to start to damage tissue. You have a capacity to hold 10 years of free radical. This is why we don't see disease like these starting until children past 10 years old, because they would have now reached their full capacity. And basically, the water that we are drinking is useless because all the particles have been, or most of the important particles have been removed. So you are going to end up with chronic diseases because of that. So once you stay on Immunogizer, you'll continue to remove the free radicals as you generate them, and you'll be using them in also productive ways, because if cancer starts, it can't survive, because once the cancer tries to feed, it's going to get hydrogen peroxide and be destroyed.
Okay, thank you, doctor. The follow-up question was, can the Immunogizer stem cell product be taken with a fat reducer?
Yes, you can combine the products. The usual way we do it at the clinic, we recommend you take the stem cell in the morning and evening with the food, and you take 1 teaspoon morning and evening with the food, and then you take 2 teaspoons of the fat reducer at night with water. Most of your fat is removed in the night, not in the day. Your body prefers to use sugar in the day and switch to fat in the night.
Okay, thank you, Dr. Robinson.
Mm-hmm.
I did a surgery to remove my fibroids, very large. since, you know, it was like 9 months pregnant, and that started to grow back. Dosage of the stem cell. She gets it 2 to 3 teaspoons daily.
Sorry, could you repeat that again?
All right. She wants to find out what is the dosage to remove fibroids.
Oh, okay, right. Well, the product is designed, so what you get in a teaspoon of immunogizer is the particles that you would get in a quart of water, right? So we kind of design it to match, because normally someone would drink it, normally should be drinking about 2 quarts to 2.5 quarts of water per day, depending on how hot this time is and so on, right? So we kind of design it to match as far as we can in that regard. Now, the reason why you're getting fibroid is growing is because the womb is generating free radicals. You realize the free radicals are damaging the womb. So what the womb does is create a extra compartment to store the free radicals, and this is what the fibroid is. And the fibroid continues to grow because the body is trying to dilute the situation. Now, once you start taking immunogizer, you begin to reverse that. And 2 to 3 teaspoons a day, which is adequate to reverse it.
Okay, thank you, Dr. Robinson. Question, should I continue my prescription drug while taking immunogizer?
Yes, the prescription, one thing about drugs are very, very quick in action. Let's say you're hypertensive and you go to the doctor, he put you on an antihypertensive drug. Within a few days, your pressure will be normalized. Now, the whole process of repairing the blood vessels is not going to take place overnight. So if you came out for your prescription for hypertension, then your pressure might be high for a few months before it comes down due to the repair work.
Yes.
Now, that means that you'll be vulnerable to the complication of hypertension, such as a stroke or a heart attack.
Right.
Now, so we would not recommend that you stop your prescription drug. You stay on your prescription drug. And what you'll find happen every time you go to the doctor, he will be telling you that the pressure is going down. Once it starts to reach in certain range, he should realize that he needs to start to back off the pressure tablets. Especially if he starts having symptoms of dizziness, that means that the pressure is dropping low. And eventually he or she would stop the pressure tablets after a while as the pressure reduces. So you should stay on the medication, but you'll sign the medication and begin to reduce. And as I said, it varies. If you had hypertension for 20 years, don't expect it to reduce a lot in 3 to 6 months. If you only had it for 2 to 3 years, by 6 months, you probably don't need it anymore.
Yeah, thank you, Dr. Robinson. And this is the last question that we're gonna have to take at this time. Does the product help with eye disease, abnormal cornea?
Abnormal cornea.
Yes.
All right. Well, we haven't seen much. I haven't done much in corneal disease. I've done some work with cataract. Cataract is much more common. I'm not an eye doctor, so people with eye problems don't come and see me regularly. But cataract is very common, which is a problem with the lens, and we are seeing reversal of cataract now. More and more, we're seeing patients who will tell you that they had blurred vision, or the vision was white out, and now they're being able to see objects and so on. Corneal injuries, I expect it to work, but I have not had any experience with that, because those patients would probably end up by the eye doctor and may have gotten surgery or so to repair the cornea.
Okay, thank you, Dr. Robinson. Okay, I'm going to invite persons to join join our Facebook, and you can ask further questions that were not answered. And I'm just going to ask Mr. Coleman just to give us the details on the Facebook.
Right, thank you very much, Mr. Murray again. Right, I just want to remind everybody about our Facebook page, where you can actually go in and link with us. We're getting quite a few messages and so on, and we'll have a much better opportunity to, well, these additional questions will be sent to Dr. Robinson. We can respond there as well. All right. So to get to our Facebook page, you just need to go to facebook.com/Jamunogizer, and that will bring up the page here. I hope everybody is seeing it. Mr. Murray, am I coming through?
Yes, go ahead, Andre. I've seen a blank.
Loading? Okay, fine.
Yeah.
So most of us are already familiar with Facebook. On the first page here, we have Mrs. Johnson, who shares her experience with Jamunogizer. It's a short video, but of course you can like our page, and that will give you an opportunity to see our latest updates and so on. But of course, the most important thing is that we want you to send us a message. So as your questions come up, you pop in the questions anytime, any day, and we'll get the response to you, usually within a few minutes. All right? Thank you very much. Mr. Murray,
Yes.
head back to you.
Yeah, thank you. All right, so at this time, I'm just going to hand back over to Pastor Johnson. That's the close off. Pastor Johnson.
Sorry, I was muted. Yeah.
Yes.
Again, we want to thank you all for being here. We're going to be back on again next Thursday. We're going to design some more new and exciting information for you. For those of you in North America, Mr. Murray will put my number in the chat so you can contact me directly, especially if you have an interest in being getting involved with marketing the product or becoming it. As I said earlier, we're a pilot program and we're going to launch it in January. And so those of you who have an interest in the entrepreneurial side of it, we're going to make that available to you. Again, we want to thank you for being a part of this exciting new product, new opportunity, and we look forward to hearing from you. Keep the conversation coming, keep the questions coming. Dr. Robinson is available, so even offline, if you get the questions to us, we're going to have him to answer those questions for you and get the answer back to you immediately. So again, thank you, Doc. Thank you, Mr. Murray. Thank you, Andre. And thank you all who took time out of your busy schedule to be on this Zoom call with us tonight. Mr. Murray.
Yeah, thank you, everybody. And I just posted a number for Pastor Johnson. So thank you all for coming. You know, it has been a wonderful, 4 weeks of sessions, and I trust that it has been very enlightening, and that, everyone will actually start using Immunogizer or Jamunogizer. All the best. Thank you once again.